Okay, welcome everybody. Um, Thank you for attending this webinar on nutritional medicine considerations in pancreatic and biliary tract cancers. Um, I see I have a couple of my classmates sitting in on this live version of it. A lot of people registered for it, but I see some of my classmates are actually on this particular live event. So I just want a little shout out to say thanks. It means a lot to me. It's really an honor for classmates of mine to actually attend a webinar that I'm putting on. It's sort of a special kind of acknowledgement that I greatly appreciate. So thank you guys. So let's get started. This is a very important topic, I feel. And it's important because pancreatic cancer and biliary tract cancers, as you know, are very lethal. The 5-year survival rates are really poor. And pancreatic cancer is now the fourth leading cause of cancer death, but you're going to see that by 2030, it very likely is going to be the second leading cause of cancer death. So right now, in any year, the cancer deaths come from primarily lung cancer, prostate cancer, and colon cancer for men. That's about 55% of male cancers. And for women, lung cancer, colon cancer, and breast cancer account for about 50% of female cancers. So if you don't get those cancers, the next cancer you're likely to develop is pancreatic cancer. And unfortunately, there's not much that can be done once it's diagnosed. So the idea is, can you prevent it? And for bile duct and gallbladder cancers, they're less common, but they are just as lethal as pancreatic cancer. And there's a lot of overlap between the two cancers because of the way they're affected or interrelated anatomically and histologically. So for lung cancer, of course, 85% of that occurs in smokers. If you don't smoke, it really cuts your risk down. For prostate, breast, and colon cancer, there's early detection, which can really help to save lives. And we have a lot of knowledge now about nutrition and lifestyle factors to help reduce risk of these cancers. But early detection is a big part of catching it early and treating the person so that their survival is better. But for pancreatic and bile duct cancers, often they're discovered at a very late stage. There's no standard early warning signs. There's no blood biomarkers yet. If you have an abdominal ultrasound or MRI, they can sometimes pick up these lesions, or they can find precancerous lesions that are there. And then what happens if they find precancerous lesions? They do very close monitoring, and if the cysts become malignant, well, then what are the treatment options? Only in 20% of cases is it even operable, where you would have the Whipple procedure, which is a 9-hour operation. And even then, their survival rates are not great. So prevention is probably one of the strategies you should have in mind. The question is, can pancreatic and bile duct cancers be prevented in many cases? There's some very promising evidence to show that certain nutrients might be highly beneficial. That's all we have to go on right now. Some of the risk factors for these cancers are not modifiable, as you will see, and some of the risk factors seem to be modifiable, where nutrition and lifestyle can play a part. But what's really important is that family history is not a main factor for either one of these cancers. So very likely means that they could be prevented with some really prudent strategies. That's where the evidence is pointing. So remember the relationship between the bile duct and then the common bile duct and the gallbladder as it enters into the pancreas and it joins the pancreatic duct, and then the pancreatic juices and bile are secreted, through the ampulla into the intestinal tract for digestion. So you have the common bile duct joining the pancreas, and so you have this interrelationship anatomically and physiologically of the bile duct and the pancreatic tissues joining together. And so that's why these cancers are very much interrelated. And I like to present them both as sort of at the same time. So about 75% of all the cancers in the pancreas occur in the head of the pancreas, where a lot is happening, including this sort of intersection with the common bile duct. And if you have cancer in the pancreas, even if it's in an early stage, if the tumor is wrapped around a blood vessel, instantly you're not a candidate for surgery. Even if the lesions are small, if it's wrapped around a major blood vessel, they're not able to do anything except give you chemo radiation, which usually is not highly effective. The other 25% of cancer in the pancreas occurs in the body and the tail. So when you look at worldwide statistics across the world, pancreatic cancer is the seventh leading cause of cancer death. But in North America, it's the fourth leading cause of death, as it is in most Western countries. Survival rates are very unsatisfactory. What's interesting is that the chemo drugs that are used are gemcitabine and 5-fluorouracil, and you'll see that certain nutrients have been shown to even enhance the efficacy of these drugs in people with pancreatic cancer. So you'll see that the nutrients I'm going to show you, not only may they help to prevent the disease, but they can also be used as complementary agents with standard treatment. Just goes on to another study showing fourth leading cause of cancer death. Survival rates are not great. What's important is that both pancreatic cancer and, as you'll see, bile duct cancer occur later in life. So if over your lifetime you've really put the strategy, you don't smoke, you don't drink, you have PSA blood tests done, you have mammograms done, you have colonoscopies done, you're going, okay, I'm managing my risk around these cancers. My risk factors for cardiovascular disease are very low. Then what's likely to get you from a cancer standpoint is pancreatic cancer. So because it occurs in this age group, and survival rates are terrible. If you develop pancreatic cancer between age 65 and 74, the average survival rate is 4 months. So the best researchers in the world are said we need to find a way to prevent this from developing, and I agree with that. So these are just more stats that I can share with you relating pancreatic cancer in Canada. I'll send you these slides. You can review this stuff on your own time. But as I say, only 2% of all cancers diagnosed each year are pancreatic cancer, but it's 6% of cancer deaths because the treatment fails so miserably. For bile duct cancers, it's less common, about 31 cases per 1 million individuals, if you look at US stats. But survival rates are really poor. And once again, it occurs in people as they get older. And there's no early warning signs. There's no early detection available. So we face the same problem. Survival rates are just dismal. If they catch it early, it's like 10%. If they catch it late, it's 2% for 5 years. And that's just how it is, whether it's intrahepatic or extrahepatic duct cancer. The survival rates are poor, very poor. So what are the risk factors according to the American Cancer Society for pancreatic cancer? Well, some are modifiable, like cigarette smoking, being overweight, type 2 diabetes, chronic pancreatitis often occurs in people who have high triglycerides, they drink a lot of alcohol. People using these Ozempic type drugs for weight loss now, they're at higher risk for pancreatitis and therefore pancreatic cancer. People who work in certain industries where certain chemicals have been linked to pancreatic cancer. A big factor is age. As you go down to the bottom here, you see that family history is a factor, but most people who develop pancreatic cancer, there's no family history. This is not just some genetic thing that occurs. About 10% of pancreatic cancer is linked to these gene mutations that you inherit, but 90% is not linked to these gene mutations. There's emerging evidence that diet and lifestyle are very important. A lot of red meat, a lot of processed meats like sausage and bacon, diet high in saturated fats, it causes proliferation of cells all throughout the body, increasing risk of cancer all over the place, including, we think, pancreatic cancer. Sugary drinks lead to pancreatitis, high triglycerides. It all sort of meshes together. And even just moderate to heavy alcohol consumption is linked to pancreatic cancer, as well as H. pylori infection and hepatitis B, possibly hepatitis C as well. For bile duct cancers, it's usually where there's chronic inflammatory state in the bile duct. Anytime there's inflammation, cells divide faster, they make more genetic mistakes that can lead to cancer. So this autoimmune condition called primary sclerosing cholangitis, it's already sort of a death sentence in itself. But one of the things is that it can lead to bile duct cancer. But bile duct stones and gallbladder stones, people eat these high fatty foods and they end up with gallbladder stones and bile duct stones. They're also putting themselves at risk for bile duct cancer. Then there's some rare cysts. In certain parts of Asia, liver flukes play an important role, not so much in this part of the world. Some people are born with congenital anomalies where pancreatic juices flow back into the bile duct and it irritates the lining and it can lead to cancer. People who have cirrhosis are at higher risk, and that often comes from too much alcohol consumption or fatty livers because of the way we live today. Leading to cirrhosis and fibrosis of the liver, but that can also then lead to cancer of both the liver and bile duct. And infections with hepatitis B and hepatitis C, those viruses can also infect those cells and create DNA changes. There's some other rare causes as well. Also, people who have inflammatory bowel disease are at higher risk. Being overweight is a modifiable risk. Non-fatty liver disease, eating too much fat, causes cirrhosis and fibrosis of the liver, but also affecting the bile duct. There was a contrast diet that's not used anymore that increased risk of bile duct cancer. Family history, in most cases, there's no family history when people develop bile duct cancer. Type 2 diabetes, that's a modifiable risk. Alcohol consumption, that's a modifiable risk. Smoking, that's a modifiable risk. Most cases of chronic pancreatitis are modifiable. So as you go down the list, you see that we think there are things you can do to prevent this cancer as well, maybe not in every case. The nutrients that I want to present today, that are supplements and off-label use of a particular drug called metformin, they show the greatest promise. In addition to a healthy diet and lifestyle, these nutrients play an important role because, as you'll see, the experimental evidence shows that they can actually encourage human pancreatic cancer cells to commit suicide and human bile duct cancer cells to commit suicide. I'm going to show you the pathways that are used here. It's a bit overwhelming if you're not looking at these pathways all the time, I'm looking at this all the time. So it all makes sense to me. I'll hit the highlights. I'll send you these slides. You can spend some time going through them, but I'll try to just give you the high-level overview as best I can. A great study published in 2022 reviewing all of this with respect to the herb milk thistle, and the active ingredient in milk thistle is silymarin. It's a flavonoid that's been shown to be effective against human pancreatic cancer cells and bile duct cancer cells that are derived from humans. So the silymarin has been shown to be very, very effective in inducing programmed cell death or apoptosis in cholangiocarcinoma, which is bile duct cancer. By inhibiting what's known as the ERK mitochondria apoptotic pathway, which I will show you shortly. And it does the same thing in pancreatic cancer cells as well. Milk thistle has also been shown to block really key steps in the development of certain cancers, including pancreatic cancer, prostate cancer, liver cancer, and skin cancer in experimental studies. Animal models where they try to induce pancreatitis, milk thistle also helps to prevent pancreatitis from developing in those experimental studies. And of course, pancreatitis is linked to an increased risk of pancreatic cancer. As they explain, pancreatic cancers begin from these precancerous lesions. So on an abdominal ultrasound or MRI, if you're willing to put yourself through that to see if you have precancerous cysts, sometimes they will pick up what are known as these intraductal papillary mucinous neoplasms. Sometimes they become cancer, and many times they don't. They're just cysts that are there. Doesn't mean you're going to get cancer. Or they can be mucinous cystic neoplasms. And they're saying these things, if they're there, have the potential to then morph or undergo malignant transformation into malignancy. Milk thistle applied to human pancreatic cells induces DNA damage to these cells, which ultimately leads to their programmed cell death through the caspase-3-7 mediated apoptosis, which I will also show you, as well as inhibiting the cancer gene known as c-Myc, which is often overexpressed in pancreatic cancer. It also blocks the pancreatic cells from dividing by blocking the G1 phase of the cell cycle by inhibiting cyclin D. In particular, I will show you how all this ties together. But milk thistle has been shown has the ability to cause a cell suicide of various human pancreatic cell lines. So they've taken human pancreatic cancer cells and they've they've basically been able to culture them and keep them alive for, many years. And that's how they test chemo drugs to see if they have a chance to kill these cells off. And then they start developing chemo drugs for human use. But they do the same thing with natural agents like this. And they're saying, yeah, these natural agents, Slimurin from milk thistle, kills all of these different human pancreatic cancer cell lines. This is remarkable because many things that they try don't kill those cells. So here's the ERK apoptosis link I was referring to. So this is a giant cell. Here's the ERK. This is a mitogen activated kinase transcription factor that goes to the nucleus, and it can modulate the function of certain genes. But in pancreatic cancer cells, and particularly in bile duct cancer cells, the ERK pathway is often overexpressed, or it's upregulated, and it's causing these cells to proliferate and to divide and keep the tumor going. But in the presence of Slimurin, it interrupts the ERK messaging and leads to cancer cell death, apoptosis. Here you see the caspase-3-7 apoptosis pathway, sort of tearing apart the mitochondria that you see Slimurin doing in pancreatic cancer cells, as I alluded to earlier. So this is just information on the ERK pathway. In many tumors, the ERK pathway is overexpressed, upregulated, especially in oral cavity cancers, melanomas, in breast cancer, and others, including bile duct cancers that often have this overexpressed. So Slimurin has been shown to inhibit the ERK in developing bile duct cancers. It represents an important potential way to reduce cancer development and possibly progression, according to the 2022 review in the Iran Journal of Basic Medicine. I will tell you something. A lot of the best research on natural agents doesn't come from North America. It comes from Iran, it comes from Australia, it comes from Japan, it comes from China, it comes from Brazil, it comes from other parts of South America. Like in North America, they are basically asleep at the switch in the research departments. But around the world, many of these nutrients are recognized for their true potential as to what they can actually do. Here's the caspase-3 apoptotic pathway inducing apoptosis again here. If you want to read about it, here's caspase-3-7 inducing apoptosis. If you just want to dig down deeper and learn about it more. But what they say is that in this 2022 study, this is now in a different journal, in Frontiers of Pharmacology, they say the expression of caspase-3 significantly increased after Slimurin treatment, which means that Slimurin or Silibin from milk thistle induced cholangiocarcinoma cell death by activating apoptosis. So both in pancreatic cancer cells and bile duct cancer cells, you have this effect, this cancer killing effect of Slimurin upregulating the caspase-3 apoptotic pathway. And Slimurin is shown to also enhance the ERK apoptosis pathway in human bile duct cancer cells. We saw that in the previous study. And then in 2021, you're basically seeing other studies saying the same thing. So the body of evidence is there that Slimurin has this incredible effect of encouraging cancer cell death of human bile duct cancer cells and human pancreatic cancer cells. So that's Slimurin from milk thistle. Tuck that in your back pocket. Here's the next nutrient. Epigallocatechin gallate from green tea, EGCG. So it's the major polyphenolic compound in green tea. It's been shown to reduce pancreatic cancer cell growth. That's amazing. So this study evaluated the capacity of EGCG to inhibit pancreatic cancer cell migration and invasion into looking at the underlying mechanisms to help decrease metastasis. So EGC reduced pancreatic cancer cell growth, migration, and invasion in vitro and in vivo in this study. The results of the study showed that it did it by preventing what's known as the cadherin switch, which uses what's known as the beta-catenin pathway, which I will show you momentarily. It also inhibited the AKT signaling pathway that's also often dysregulated in pancreatic cancer. And then when they said, well, if we co-treat these cells and we give them antioxidant defenses like N-acetylcysteine, which would raise their antioxidant defense, very often cancer drugs stop working when you put a lot of antioxidants into the cancer cell. They're saying, no, even when we put antioxidants in there, like N-acetylcysteine to raise glutathione levels and gives the cancer cell a chance to stop reactive oxygen species from killing it, say, no, the EGCG still continued to have this effect on the AKT pathway in causing cancer cell death to occur. Moreover, they said EGCG synergized with gemcitabine. So gemcitabine is a standard chemo drug used in pancreatic cancer patients. And they're saying in the presence of EGCG, gemcitabine worked even better to cause cancer cell death by inhibiting the AKT pathway. So EGCG may prove beneficial to improve gemcitabine's sensitivity. It inhibits even on its own the AKT pathway. So what does this mean? So this is the AKT pathway. Very often in many types of cancers, including pancreatic cancers in human, you see a dysregulated pathway where on the cell surface, this is receptor tyrosine kinase. It becomes overactivated. It then phosphorylates the phosphoinositol 3 kinase, which then signals down through PTN to AKT. Here's the AKT. AKT then tells the nucleus of the cell to encourage cell growth, protein synthesis, more energy production, so you have more tumor growth and more resistance to chemo drugs, and you have migration and invasion and metastasis, and you die. AKT also upregulates, where's my mouse? Here it is. It also upregulates the mTOR pathway, which does the same thing. We'll talk more about the mTOR pathway. So ECG inhibits in human pancreatic cancer cells this often overexpressed pathway to shut down the growth so that you inhibit growth of the tumor cells. So EGCG, this study in 2016, looking at its overall effects on cancer in general, all the different mechanisms for cancers of many different types, saying it inhibits this phosphoinositol 3 kinase AKT pathway, which many cancer cells use. It also regulates the ERK pathway and cyclin D, which we'll talk about. It also downregulates nuclear factor kappa beta and STAT3. You're going to see these in a moment. It also inhibits cancer cells from repairing any DNA damage. So if you try to damage the tumor cell with things like silymarin that can cause DNA damage, sometimes the tumor cells will repair the DNA damage so they can stay alive. EGCG inhibits repair of cancer cells to repair their own DNA so that if they're going to die because they can't repair it, apoptosis will naturally occur. And it inhibits angiogenesis so that the tumor cells can't form new blood vessels for metastasis and increased tumor growth. So EGCG is multimodal in its anti-cancer properties. It also helps to upregulate the tumor suppressor genes that can repair DNA damage or direct the cancer cell to commit suicide if the damage is so bad that it's going to become a tumor cell. It can actually encourage the cell to commit suicide rather than being transformed into a malignant cell. It also modulates the amount of reactive oxygen species inside cells. Here's how it inhibits angiogenesis. When solid tumors reach a certain point, they secrete vascular endothelial-derived growth factor, VEGF. It causes new blood vessels to form into the tumor. So the tumor gets more blood. The cells can keep thriving, and then they can split off and metastasize through the bloodstream or the lymphatic system. And so EGCG helps to shut down angiogenesis. Here's cyclin D. I was talking about it earlier because we saw that silymarin and also EGCG inhibit cyclin D. So normally when a cell is going to divide, most cells in your body are in a quiescent stage. You're in the G0 for this phase. They're not dividing right now. When they just choose to divide, they release cyclin D, and that starts the cell cycle where you get DNA synthesis and mitosis, and now a new daughter cell forms. But in cancer cells, very often what happens is cyclin D is constitutively upregulated, where it's constantly causing the cell to divide. It's encouraging the cancer cell to divide, and that's how the cancer cell keeps dividing. So you see that in a normal cell cycle, cyclin D normally initiates the cell to divide, but then once the daughter cell is emerging, it gets shut off. But in cancer, cyclin D stays elevated so that the tumors, once they're formed, they keep dividing, and you form a tumor mass, and then you get a migration and metastasis. Also, so EGCG helps to shut that down. It also inhibits the production of matrix metalloproteinases. These are like little drills. The cancer cell drills a hole from the pancreas into the bile duct into the liver. So you get adjacent migration of the tumor. It doesn't even have to go through the bloodstream. It just goes from one tissue to the next because it's secreting matrix metalloproteinases. And I'm saying EGC has been shown to help to shut that down in many tumor cells. So it has many anti-tumor effects as summarized here in this article. And one of the ways is that it's shutting down most of the effects of green tea are dependent upon these catechin-mediated molecules, especially EGCG. It induces apoptosis of the cell cycle arrest by also affecting receptor tyrosine kinase. We saw that earlier. It can also generate free radicals in cancer cells that will cause so much free radical damage that the cell will have to commit suicide. So here's receptor tyrosine kinase again. Receptor tyrosine kinase on the cell surface, upregulating phosphoinositol 3 kinase down through AKT and then causing proliferation and cell migration. So in cancer cells, this particular signal transduction pathway is continually switched on. That's not supposed to happen. And so EGCG helps to switch it off. And this is the Wnt beta-catenin pathway. It's complicated to explain, but in many cancers, it's in a dysregulated state where it's constantly switched on, so it upregulates cyclin D and the cell is dividing all the time. And so EGCG has been shown to tamp down the Wnt beta-catenin pathway, so it stops that growth signal from occurring. So multimodal anti-cancer properties of EGCG. So we talked about silymarin from milk thistle, EGCG from green tea, and then the indole 3-carbinol, which of course is multimodal for many types of cancers. Indole 3-carbinol is found in cruciferous vegetables, as you know, and the body metabolizes some of that into DIM, which is a byproduct, but it has anti-cancer properties as well, both in vivo and in vitro. But these compounds are effective inducers of apoptosis. Multiple cellular signaling pathways is a testimony to their pleiotropic behavior to reduce cancer risk. It's been shown to sensitize cancer cells to other chemotherapeutic agents, so it can be used as an adjunct with chemotherapeutic drugs. A lot of doctors just ignore this research. It's extremely non-toxic. So here's a study in 2008 showing that the indole 3-carbinol reactivates in pancreatic cancer cells the P16 tumor suppressor gene. So what happens in pancreatic cancer and many other cancers as well is that this P16 tumor suppressor gene, which would normally sense that a cancer cell is dividing and shut it down, becomes hypermethylated, so the gene gets switched off. So what indole 3-carbinol does in these pancreatic cancer cell lines is it hypomethylates, it removes the methyl group. So now the gene is switched back on, and the P16 gene, when it's switched back on, what it does is it then shuts off cyclin D inside the cancer cell. So that's really what it's doing. So I'm going to show you a picture of it in a second. So it's basically going to inhibit cyclin D, and genetic inactivation of the P16 gene or a deviation of its function generally is found in 50% of all human cancers. This is a very important gene to have it working properly throughout your lifetime. So the P16 gene, when it's switched on, what it does is it blocks cyclin D, and by blocking cyclin D, then you don't get you arrest the G1 cycle, which leads to apoptosis, or the cell goes into senescence. So that's what you're trying to do here, is to switch the P16 gene back on, so it will ultimately inhibit cyclin D from having its effects, which in turn are going to lead to apoptosis. So you can read more about that in the link. It also enhances the efficacy of gemcitabine. So you take human pancreatic cancer cells and you expose it to indole 3-carbinol or gemcitabine, or you combine both of them together, and it goes, hey, they both work at helping to stop cell growth of pancreatic cells, but when we combine them, they work even better. And the reason is that in order to get gemcitabine into a pancreatic cell, you need to have this particular transporter system called the HENT1. And often cancer cells, once you expose them to gemcitabine, they shut that transporter down to protect themselves to prevent more gemcitabine from getting into the cell, so the tumors become resistant to chemo. But in the presence of indole 3-carbinol, it forces the cancer cell to keep expressing that transporter, so more gemcitabine will get in and kill the cell. So they're saying this particular nutrient should be used as a supplement when you're giving people gemcitabine in pancreatic cancer. But of course, they don't do it, but you can suggest it. So the indole 3-carbinol, the results were that it upregulated that particular transporter mechanism. Gemcitabine did not show that effect, but when you combine the two of them together, you got ultimate expression of gemcitabine and a better killing effect. But on its own, indole 3-carbinol was still able to have a cancer killing effect on these pancreatic cells. This study demonstrates that the upregulation of this gene expression may be a novel mechanism involved in the additive effect of indole 3-carbinol and gemcitabine. So that's number 3. What about melatonin? One of my other favorite topics to talk about. Here's a study in 2023. This is recent stuff, right? Pancreatic melatonin enhances the anti-tumor immunity in pancreatic adenocarcinoma through regulating tumor-associated neutrophils infiltration and netosis. What does that mean? It simply means that in pancreatic adenocarcinoma in a mouse model, when they give melatonin supplementation, it suppressed tumor growth and it blocked the melatonin pathway. When you block the melatonin pathway, the tumor growth progressed to a significant degree. So when you allowed melatonin to take its effect, it had this tumor growth suppression effect. When you block melatonin's effect on the tumor cell started to divide like crazy. So this anti-tumor effect was largely related to what are known as upregulating tumor-associated neutrophils. So I'm going to make this really easy for you. It's on the next slide. When you provide melatonin supplementation to these human pancreatic cancer cells, it forces them to secrete this chemokine called the CXCL2, which then stimulates immune cells, these tumor-associated neutrophils, to go into the tumor and kill the tumor. And when you take melatonin away, this effect stops. So melatonin upregulates the tumor killing effect of neutrophils in these models, which is incredible, actually. But in 2019, you had this review paper on melatonin and pancreatic cancer. They're saying in vivo and in vitro studies have shown that melatonin supplementation is an appropriate therapeutic approach for pancreatic cancer, even in humans. Melatonin may be an effective apoptosis inducer in cancer through regulation of large number of molecular pathways, including oxidative stress, heat shock proteins, and vascular endothelial growth factor. In 2021, they say the anti-cancer effect of melatonin is mediated by integrated mechanisms such as apoptosis and induction, immune system modulation, targeting cancer altered mechanisms, angiogenesis inhibition, and anti-metastatic effects. Combination of melatonin with conventional anti-cancer therapy showed positive effects. It also improved sleep quality and the quality of life of the cancer patient. It enhances the effects of chemotherapy. Studies show that melatonin's anti-cancer effects is not tissue specific, so a wide range of cancers, including pancreatic. Its therapeutic and preventive properties were reported in cancer arising from different tissues. There's some great review papers. You ought to read them. This one in 2021, I just took this, it showed all the different anti-cancer effects of melatonin. There's too many of them for this to be ignored. And the thing is that as you get older, your melatonin levels drop down. So when you get into the high-risk years for pancreatic cancer and bile duct cancers, you have hardly any melatonin left. You need to supplement it after the age of 40. That's my view for many reasons. Next, selenium. So this is another one of my favorite nutrients because higher levels of selenium in the blood might be associated with longer survival rates in pancreatic cancer. And higher levels of selenium appear to be protective to a large degree in pancreatic ductal adenocarcinoma. So it's also been shown to enhance the efficacy of gemcitabine. So they say since gemcitabine is a standard first-line chemotherapy for pancreatic cancers, finding drugs that synergize to improve its efficacy is of interest. So that's what we saw already. The indole 3-carbinol does that. It enhances the effects of gemcitabine. But here we see that they've tested a whole bunch of other things, resveratrol, EGCG, quercetin, and so on. But they're saying in this study, we saw amazing effects with selenium. So when you take selenium as a supplement beyond what your body's normal physiological needs are, the byproducts of that selenium become these methylated forms of selenium. We thought they were just byproducts of metabolism that didn't do anything. Well, they actually have a cancer-killing effect on certain pancreatic cancer cells. And then when you combine it with gemcitabine, the gemcitabine cancer-killing effect is even greater. So they're saying the influence of selenium on these human pancreatic cancer cells are they induce apoptosis of pancreatic cells, they slow the replication rate, and they also enhance the transporter to bring more gemcitabine into the cancer cell. And then we also see in 2023 this great study showing that selenium at doses that are super physiological, not just the RDA amount of selenium, I'm talking about 200 micrograms of selenium a day from a supplement, has the potential to induce what's called ferroptosis of pancreatic cells. So in ferroptosis, what happens in cancer cells is they're trying to get more iron so they can build more cytochrome chains, and they need iron in order to generate energy through their mitochondria cytochromes. So what they do is they have higher levels of the protein. What's the name of the protein again? We're going to see it here. Come on, Jim. Well, we're going to see it in a second. I forget the name of this transporter protein, but basically, because there's a lot of iron in cancer cells, if you subject them to a lot of these methylated selenium products, the iron and the selenium interact in a way that generates a gazillion free radicals, and that reactive oxygen species that generated basically blows it up essentially. So that's called ferroptosis, cell death, and selenium has been able to do that. So here in 2010, we saw that low concentrations of selenium are required for normal growth, and it's an essential part of life. But high concentrations of selenium, we're talking 200 micrograms a day from supplementation, potentially inhibit cell growth, and they have a tumor-specific effect. It's where selenium induces apoptosis of malignant cells at concentrations that do not affect the normal cells. So at higher levels of selenium, even though you're producing these sort of toxic byproducts, they're only toxic to the tumor cells because they're more vulnerable and they don't have antioxidant defenses. Your healthy cells, it doesn't kill them, it doesn't damage them. So selenium supplementation has been found to be valuable in the prevention of hepatocellular carcinoma by hepatitis B, and in reducing the incidence of liver cancer in general, and decreasing mortality from colorectal, lung, and prostate cancer. So that's already been established. They're saying that has potential also in pancreatic cancer. They say that the selenium byproducts they primarily affect the caspase independent apoptosis, generating DNA strand breaks and these other mechanisms. So what happens is the selenium byproducts accumulate inside the cancer cell, and they have multimodal effects on encouraging the cancer cell to commit suicide and also inducing ferroptosis, as we saw earlier. So that's just basically saying that it's doing the same thing. It upregulates some of the tumor suppressor genes. It arrests the S phase in the cell cycle. And it's all these methylated components that are doing that, inhibiting cyclin D, inhibiting ERK, inhibiting the AKT pathway. So it's doing a lot of the same things that we saw Silimarin and EGCG doing, and melatonin. So I'll just point out some of these pathways for you. You can see them inside the cell, some that we haven't covered yet. Here's the P16 tumor suppressor gene, which is going to inhibit the cyclin D, right? Once it's active, when it's working properly. Here's that AKT here's receptor tyrosine kinase coming down, branching off. Sometimes it goes through phosphoinositol 3 kinase to AKT. Here's the AKT system. You don't see the rest of it represented here properly. And here's STAT3. We're going to see that later. Let's keep going because we're going to run out of time. So I said earlier that there's the G1 phase where cyclin D is involved. But when we're talking about selenium, it's inhibiting the S phase where DNA replication occurs in the cell cycle of pancreatic cancer cells. So selenium also inhibits vascular endothelial-derived growth factor to inhibit angiogenesis. It counteracts metastasis. The tumor-specific toxicity, together with its anti-angiogenic and anti-metastatic effects of selenium, make it a highly interesting agent in the arena of chemotherapy. I agree. I think you should be taking 200 micrograms of selenium every day. I'll show you where the evidence gets stronger. It gets stronger right here. In recent years, 2019, 2011, published studies showing that people who are getting supplement levels of selenium at 200 micrograms a day, roughly, their risk of heart failure is lower because the heart also undergoes oxidative stress, and selenium can help to prevent that by upregulating glutathione peroxidase in the heart. And it also enhances the immune cell killing effect that immune cells have if you provide sufficient selenium to immune cells that's higher than the RDA, usually around the 200 microgram level, which we see in Sweden. They recommend to all their elderly people. So 200 micrograms of selenium a day, I think on the prevention side is something to strongly consider. Then there's vitamin E succinate. It's one of my favorite molecules. It has a broad range of anti-cancer killing effects that I've outlined for you here. I've given you all the research on it, but it also does an amazing thing in pancreatic cancer cells. It inhibits survivin. So to make a long story short, cancer cells, to prevent themselves from undergoing cell death, they secrete a peptide called survivin, and it blocks the caspase 3,7 apoptosis pathway, so the cancer cell won't commit suicide. But if you block survivin, as vitamin E succinate does, then it allows the cancer cell to undergo cancer cell death. So it's been shown to be quite effective. And these are all the effects that survivin has on helping cancer cells maintain their viability. If you inhibit survivin, you basically shut the cancer cell down. It's going to commit suicide. Then there's curcumin, one of my favorite molecules, again from the spice turmeric. A lot of research showing that it blocks key steps in pancreatic cancer development, inducing cancer cell death in human pancreatic cell lines. It also inhibits nuclear factor kappa beta, which often is driving cancer cell growth, as we'll look at. Another study in 2016, curcumin, a natural multi-target treatment for pancreatic cancer. In all different human pancreatic cancer cell lines, all these different ones, it's been shown to have anti-proliferative effects, induces apoptosis, inhibits angiogenesis. It does all these incredible things experimentally. At some point, you have to start taking this seriously. Also blocking the STAT3 signaling message. Here's STAT3. I pointed it out to you. It's often overexpressed in human pancreatic cancer cell lines. It translocates to the nucleus. It causes the cells to divide at a faster rate. And again, overexpressed STAT3 is commonly a factor in overstimulating the genes that code for proliferation in cancer cells, and specifically in this case in human pancreatic tumor cells. You want to shut that down. So, and then there's this nutrient. You may not know that much about artemisinin, but it's derived from an herb called the Chinese wormwood. It's used in certain parts of the world to contain malaria, because in malaria, the red blood cells have a lot of iron kicking around, and the artemisinin, just like high levels of selenium, gets into the malaria-infected red blood cell, and it causes a reactive oxygen species to form, and it blows the malaria-infected red blood cell up. So in people who have quinine-resistant malaria, they use artemisinin. Many parts of the world, they use it preventatively, but it also has cancer-killing effects because it interacts with the iron, just like selenium does. It interacts with the iron inside the cells because cancer cells overexpress. Here's the receptor, the transferrin, this particular transferrin receptor that you see represented here is the TFR. Cancer cells have more of that receptor to bring more iron in and to accumulate it. And then the high doses of selenium and also artemisinin can interact with that, with the iron that's in the cell, and basically cause it to blow up. And we're seeing that it does it in pancreatic adenocarcinoma. And it does it in a dose-dependent manner, just like gemcitabine, shutting down tumor growth. So they're saying it's a good targeted molecule for pancreatic cancer, both prevention and treatment. And so there's an excellent review on artemisinin in cancer. I'll leave that with you to review on your old time. One of the effects also is that it's inhibiting cyclin D, as you'll see in that research article. Then we have metformin. Metformin is a drug that's used for type 2 diabetes to improve glucose function. but it has impressive anti-cancer properties because it kills cancer stem cells. Most cancers arise in tissues from the stem cells inside the tumor, inside the tissue. And that's why cancer cells are so resistant to treatment, because stem cells can morph and mutate so easily. They can really maneuver, and they're very agile in what they can do in terms of epigenetic and genetic switches. So killing cancer stem cells is absolutely incredible. They're saying it's a fantastic adjunct for chemotherapy and radiation for many treatments. And in cases where there's premalignant cysts, so in say someone's diagnosed with these cysts in their pancreas, I think they should be taking 1,000 milligrams of metformin a day to try to kill those cells before they can take an effect. I mean, you can read more about it there. Studies looking at metformin as an anti-cancer agent in 2018, they're saying, studies using various cancer models, including breast, pancreatic, prostate, and colon, are saying it kills cancer stem cells in those tissues. This is something to be aware of. And it has a great effect on shutting down the tyrosine kinase AKT pathway, which also bleeds into the mTOR pathway, which I'm going to show you momentarily. Here it is here. So here we see this receptor tyrosine kinase down through AKT. And then the final step is mTOR as a transcription factor turning on cell growth. So metformin is beautiful because it shuts down mTOR. That's really, we think, part of its anti-cancer properties as well. So Cancer Management Research 2018-19, metformin in cancer inhibits the mTOR pathway, preventing cell growth. It may activate a very important tumor suppressor gene, the p53 tumor suppressor gene, and it has all this great effect on people undergoing cancer. They should be using it as an adjunct. More information here of all of its anti-cancer properties. It's an incredible little drug. The risk of metformin is that it may increase the risk of Parkinson's disease. But in somebody who has premalignant lesions already in their pancreas, I would say, okay, you know what, I'll take that risk. I need the metformin. I don't want to develop pancreatic cancer. What we see is in type 2 diabetics, a 2010 consensus report showed that people with type 2 diabetes are at increased risk for many types of cancer. And if they're on this particular drug, the pioglitazone for increased glucose uptake, the risk of bladder cancer is significantly high. But in a meta-analysis of 20 publications looking at over 13,000 cancer patients who also had type 2 diabetes, they're saying patients who were treated with metformin had better overall cancer-specific survival than those who were treated with other glucose-lowering agents, because it kills cancer stem cells, inhibits the mTOR pathway. Risk reduction was significant among patients with prostate, pancreatic, breast, colorectal, and other cancers, but not for lung cancer. Then in this review paper in 2005, they're saying, since 2005, we think that the use of metformin has reduced risk of cancer by 23% worldwide. And in people with type 2 diabetes, we think the ones using metformin have shown a 30% lower risk of cancer overall than the ones who are on other drugs. And it's very likely diabetics are very prone to certain types of cancers like colon, rectum, pancreatic, and liver cancers compared to non-diabetic patients. Genistein from soy. So in genistein, you have these soy isoflavones. The genistein in soy, I love soy products, inhibits in pancreatic tumor cells the G1 cell cycle. It interrupts the cell from dividing by blocking the quiescent phase, moving into the G1 phase. It also downregulates the STAT3 transcription factor, which I showed you earlier. Another study in 2018 study, the results showed genistein decreased cell viability of 2 pancreatic cancer cell lines in a dose-dependent manner. It was not harmful to normal pancreatic cells. And our results clearly show that it causes cell cycle arrest, and so the cells can't divide, and it creates more reactive oxygen species, so they'll kill themselves. And it upregulates the STAT3 signaling, or modulates STAT3 so that it can't overstimulate the nucleus to produce more tumor cells. It's just does all these great things, and it also increases the efficacy of the other cancer drug used for pancreatic patients, which is 5-fluorouracil. The conclusion, gemcitabine can potentiate the anti-tumor effects of 5-fluorouracil by inducing apoptotic as well as autophagic cell death. The results demonstrate the potential of genistein as an adjunctive therapeutic agent against pancreatic. People who have pancreatic cancer should be using soy isoflavones as part of, if they're on chemo and they're using 5-fluorouracil, the genistein can help make it work better. Now remember that I think people should have soy foods at least 3 times a week to get those things because they have many anti-cancer properties, not just for pancreatic cancer potentially. But remember, there's a lot of genistein also in Adiva Prostate 40 Plus for men and in women's hormonal balance. So if you or your patients are on those products, you're already getting a significant amount of genistein from those supplements. Of course, I always talked about immune modulation because when the immune system's not working, it's very hard to fight cancer off. There's studies have shown repeatedly that medicinal mushrooms can very much, like reishi mushroom, can very much enhance the efficacy of immune cells to fight tumors and to help guard against tumor cell development. There's some references here that I've showed you before. They're fantastic research papers. On the nutrition side, you want to always keep your blood sugar down below your fasting blood sugar below 5 millimoles per liter. I've showed you some standard ways to do that. You want to avoid the bad fats in your diet that I talked about all the time because they can increase risk of these cancers. There's a great review article in 2020 on fats and cancer. So don't take my word for it. Read the research. You'll see the healthy fats are good and the bad fats increase not only heart disease, but risk of cancer. These are just some key nutrition strategies that I try to talk to my own patients about to try to make it practical for them. It's no red meat, no pork, use chicken breast, turkey breast, but I try to show them how to go about it in a way that's reasonable. Keep the alcohol out, get the soy proteins in. If you can have 3 to 5 cups of green tea a day, you do that. Here's some good sources of low-fat protein that'll build your lean mass, but won't overstimulate cells to the point where you're at risk for cancer. So here's what I've done over the years, and I'm glad as this research emerges, I'm glad I did it. I know that at age 50, your immune system gets weaker and your liver detoxification enzymes become more sluggish. So those things can lead to a higher risk of cancer and virulent infection. So at age 50, I made this supplement before, but I think everybody by age 50 should be taking it. So look at what it has. It has the milk thistle in it, standardized to 80% slimming. It has the indole 3-carbinol already in it. It has the reishi mushroom extract for immune modulators already in it. And then I also take Body Burn every day. I take 2 capsules a day to help keep my body fat down, but it's loaded with EGCG, as I will show you. Our all-in-one multivitamin, I'm very proud of it. It's the most potent one in Canada. It already has 400 IUs of vitamin E succinate. That's the only form of vitamin E that has anti-cancer properties. And it seems to have some specific ones in these experimental models with pancreatic cancer. And here's the 200 micrograms of selenium that I think is critical. And then I take Sleepy Naturals because I'm over the age of 40, which has the melatonin and some other sleep aids. Now, you could just take melatonin on its own, but as a sleep aid, you're better off to combine it with some other natural agents. In higher risk individuals, if you have an abdominal ultrasound or MRI and they see you have some of these precancerous cysts, I would then add artemisinin, and I get a prescription from my doctor for metformin 500 milligrams twice a day. So here's a Diva Immunodetox Prime. It has 300 milligrams of milk thistle in 1 capsule. I take 2 a day. That's 600 milligrams of milk thistle, standardized to 80% salimarin. That's a very significant dose. That's not just some frivolous, flowery window dressing amount. That's the real deal. Same with indole carbonol, 50 milligrams. That's 100 milligrams a day. You know how many cruciferous vegetables you'd have to eat to get 100 milligrams of indole 3-carb? That's a sizable dose, combined with the immune modulators, reishi, mushroom, and astragalus. I think everybody over the age of 50 should take it. Remember that these cancers occur as you get older. So these nutrients become more important as the person gets older. In the Adiva multivitamin, there's the vitamin E succinate in the selenium, but of course, it's loaded with everything else, antioxidants, B vitamins, calcium, vitamin D. You know this vitamin probably as well as I do. The Adiva Body Burn product, not everybody takes this. I take it because the EGCG has been shown to help prevent prostate cancer in human studies. It also has been shown impressive effects in women that have breast cancer awaiting surgery, helping to shrink the tumors. But now we're seeing the effects on human pancreatic cancer cells, which gets me even more excited. But in addition to that, it turns on brown fat, so you'll burn more calories at rest and give it off as heat to the environment to keep your body fat down. And chromium helps to keep your blood sugar down. And the Garcinia cambogia helps to prevent the conversion of carbohydrates into fat. So at the bottom of the slide, it shows you what Health Canada allows us to say about this product because the evidence is so strong. But the EGCG has these anti-cancer properties that I don't think can be forgotten about. Most people don't have 3 to 5 cups of green tea a day. Whereas if you're having a couple of capsules a day of body burn, you've got it covered right out of the gate. For Sleepy Naturals, we have this product, as you get older, I take two or three capsules of this a day because I'm, older, but someone at age 40 could just take one. But it also has the 5-HTP to raise serotonin levels. The GABA helps you get to sleep. The Bacopa monnieri helps to solidify short-term into long-term memory while you're sleeping. So, you want to get these synergistic effects as best you can, but you're also getting the melatonin, which we saw earlier, helps to improve the efficacy of tumor-associated neutrophils invading the cancer. So 2 days ago, this on Medscape, you had this report called Europe is facing a pancreatic cancer emergency. Saying, mortality rates are over 90% for pancreatic cancer, according to Dr. Alfredo Corrado. He's the chairperson of Pancreatic Cancer Europe. He says by 2030, it's going to be the second most common cause of cancer mortality because we're improving prostate, colon, breast, lung. We're improving early detection and treatment. But for pancreatic cancer, it's still stuck in the mud. There are so many challenges: lack of awareness, hard to diagnose it, no early screening. Survival rates are poor. The treatment options are lousy. The overall survival rate's about 4 months. Only 3% of people live 5 years. It's saying in Western Europe, people are likely to develop it than anywhere else in the world. That includes North America too, because he says lifestyle, obesity, sedentary behaviors, too much red meat consumption, excess alcohol, these things factor in because it's not a family history related disease to a large degree. Smoking, type 2 diabetes, chronic pancreatitis from alcohol, triglycerides, too many sugars in the diet, all those factors. And of course, as you get older, the risk increases. So my point to you is that for you, your family members, and your patients, there's a whole lot of reasons to have a prudent diet where you keep your blood sugar down, try to eat the healthy fats, keep the alcohol out, keep the green tea in, use soy products, do all those lifestyle things that help to prevent a whole array of cancers, including this one. But on the targeted nutrient side, really, this is all we know. What we know is that we have milk thistle, the indole 3-carbinol, better immune system function, vitamin E succinate, selenium, EGCG, melatonin. And for higher risk people, artemisinin and metformin. So it's a matter of, am I going to be proactive? Or am I just going to say, well, this is nice, it's experimental, it may not really work. I'll just take my chances. For me, I like the idea that I'm doing something proactive, using targeted nutrients that are not toxic, that also have many other multimodal properties for detoxification, preventing other types of cancer, increasing my ability to burn body fat. It has also neuroprotective effects from EGCG. I mean, it's not just one thing. So these nutrients are really important. I hope that you will talk to your patients about the importance of these things because this is a devastating diagnosis to have. And this is all we really know right now about the potential to prevent it. I hope you liked it. Thanks for sitting in. I greatly appreciate it. Now, for those of you who are not Adiva customers, you want to learn more about monthly specials, wholesale prices, the affiliate program, just contact Arlene Walker. She's on the call today with us. She'll be happy to explain it all to you. Not a heavy, high-pressure sell. That's not my style. It's not our style at Adiva. You can learn more at the website adivainfo.com. If you are interested in becoming a registered orthomolecular health practitioner, he's at 22 courses now in nutritional medicine. Contact Brad at the Global Integrative Medicine Academy there. And other than that, I will say thank you very much for attending. And if there are any questions, I'll be happy to address them right now. Thanks again for sitting in, guys. I do appreciate it very much. I'm looking for my question and chat box. Anybody have a question? Well, okay. I don't see anything coming up. I will say thank you guys. Be well. I'll have another webinar coming up at some point soon. I'll try to keep them very clinically relevant. I hope this was helpful, and stay healthy and well. And I will see you soon. Thank you.